Hello everyone, and welcome to the Arthritis Society's special edition of Arthritis Talks, your questions, our answers about COVID-19. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society, and it's very nice to be able to come together with many of you again. For those of you attending an Arthritis Talks webinar for the first time, welcome. Following our first COVID-19 webinar a few weeks ago, we received countless questions and requests for a follow-up presentation. We know the need for trusted information about COVID-19 and arthritis is profound, so we're delighted to bring you Dr. Vandana Ahluwalia and Dr. Alan Lowe to share their knowledge today. These experts are on the front lines, helping people with arthritis manage their health through this difficult period. Before we get underway, just a few logistics. First, this webinar is best viewed on a laptop or desktop computer. If you have a question, click on the Q&A button at the bottom of your screen and type it out, or you can email it to arthritistalks@arthritis.ca. We will try to get to as many questions as possible during the hour we have together today. Thank you very much to those of you who have sent questions in advance. They've really helped us to prepare much of this presentation. If you'd like to chat with the online moderator of the webinar, please click on the chat button at the bottom of the screen. So let's get started. We, the Arthritis Society, is Canada's national charity, dedicated to creating a world where people are free from the devastating effects of arthritis. We do this by funding research, by advocating to governments on your behalf, and by providing timely, evidence-based information to help you live a good life. While we understand that this continues to be an uncertain time for everyone, people living with arthritis are feeling especially concerned. I want you to know that we are here for you, and we will continue to be here to do everything that we can to support you as we navigate this chapter together. This Arthritis Talks webinar is just one of those forms of support that we provide. I'm pleased to welcome back Dr. Vandana Ahluwalia, rheumatologist at the William Osler Health Centre in Brampton, Ontario, and past president of the Canadian Rheumatology Association, and Dr. Alan Lowe, pharmacist and clinical associate professor in the Faculty of Pharmaceutical Sciences at the University of British Columbia, to speak with us today. Many of the questions we received in advance follow similar themes. So Dr. Ahluwalia, could you start us off and just provide a quick overview of what you and Dr. Lowe plan to discuss today?
That's my pleasure, Sean. Thank you very much for allowing me to give everyone listening an update on the coronavirus. It's been a month since my first presentation on March 26, and a lot has happened. The Arthritis Society, along with your team, thought it would be a good time to give you listeners the latest of what we've learned about the virus and any effect that it may have on those who have rheumatic diseases and arthritic conditions. I've been tracking this information for you, and we have an excellent update that I have compiled along with Dr. Lowe and other ID specialists, as well as specialists around the globe. We've consolidated this information for you in this presentation. As you know, the information and the accrual of data is changing on an hourly and on a daily basis to help inform us better. What is interesting is that the researchers, the pharmaceutical companies, and other stakeholders worldwide are banding together in a unique way to help combat this disease like never before. Today, I also have the privilege of having Dr. Alan Lowe join us. Some of you might know that I'm a great proponent of team-based care for rheumatic diseases and have been involved in moving our specialty towards new models of care that helps to treat the patient as a whole. Alan is a pharmacist involved in the care of people with arthritis and will be able to add his considerable expertise to the presentation today. So the overview today will be around the current state of COVID-19. We are going to update you on preventative measures, and then we are going to answer your questions, the commonly asked questions by people with rheumatic diseases and arthritis, ones that have been sent in advance, and also ones that will be sent in during this presentation. And then finally, how to make the best of the situation that we're in. We can do it.
Great, thank you so much. So let's get started with our first question. Dr. Ahluwalia, many people are following the numbers every day, and we hear news story after news story Can you update us on what we've learned in the last month about COVID-19?
So yes, you are quite correct, Sean. There is a lot of information out there from social media and other types of press-related media, and various different prime ministers and presidents who are giving us information that they know. So about a month ago, I showed you statistics from the Johns Hopkins University dashboard, which is updated in real time. There are a few things that I want to point out to you. First of all, the screen on the back part of this slide is showing you the global tally was just under 500,000. And as of recently, about a week ago, it was over 2.3 million. What you can also see is that China had the highest number of confirmed cases back at the end of March, just over 81,000. And the US was in third. The US has now caught up and is leading with more than 700,000 cases. The other thing that is also noticeable that China's numbers really haven't changed significantly in the past month. In other words, it was 80,000 then, it is also 80,000 now. That is a good sign that the virus can be stopped in its tracks. So let's look at Canada from the Johns Hopkins webpage. You can see that what I presented to you last month, as of March 21st, there were 1,100 cases in Canada. On March 25th, which is 4 days later, there were 3,400 cases. Then as of April 18th, 3,200 cases, and April 22nd, 4,100 cases. What you can see, there's a proportional increase at the end of March that is significant. That is 300 times what would be, which is certainly very high. Now you can see that the proportional increase is about 25%. The doubling time of the virus at that time back in March was about 4 to 5 days, and it's now seemed to be spreading out to 10 to 12 days. This is certainly giving us some hope. So I showed this pictorial last month, but I still want to reiterate that with the coronavirus, the most common thing that you might get is very mild illness. 80% of patients have mild illness, flu-like symptoms, low-grade fever, and things like that, and they will get over it. About 15%, however, will be hospitalized. 5% may have to be admitted to the intensive care unit and require a ventilator, and 3% will die from this condition. Most people, however, will have mild disease. So the question was around, is flattening the curve working? So if we leave the virus on its own, as you can see in the orange graph here, we have a high peak but a shorter duration of infection. This does not allow us to manage patients with the disease, as this will exceed the capacity of the healthcare system. That is why we want to flatten the curve through our public health measures, such as social distancing, but the most important is physical distancing. This will allow us to take care of patients who are severely ill, but that might mean that the pandemic may go on a little bit longer, so we do need to be patient. So this is the most recent update from Worldmeter's website for Canada in particular, and this was updated as of April 21st. You can see on the first graph on the left-hand side with the blue line that this is the total number of cases in Canada. What you can see is that in the middle of March, so in the middle of that graph, there was an increasing number of cases because the slope of the graph is quite steep. But now you can see that the number of cases are declining, not declining yet, but soon to, because the graph is leveling off. In the second graph, which is a bar graph, you can see that it starts to look similar to flattening the curve. We may be reaching the peak. We don't know exactly when that is going to be, but we may be getting there sooner. There are also, in the third graph, you can see that there are some differences amongst the provinces depending on what point in the course of the pandemic they are. The good thing to note is that social and physical distancing measures that you are following are working to flatten the curve. Each person who is infected can on average further infect 2 to 3 people. If we continue to practice the physical distancing that you have been doing, we can reduce that to less than 1 person. And this will eventually result in the epidemic dying out. These public health measures are working. And if we are patient and band together, we can beat this pandemic. So finally, what have we learned in the past month about the virus and how to tackle it? Well, we know that there's no evidence yet that the warmer weather will result in less transmission or cases. We know countries that have already warmed up. We're still a bit cool here in Canada, but other countries like Singapore in which the transmission has not slowed down. So we also know that from the influenza virus that the lethality of this virus, the mortality, is about 0.1%. For COVID-19, from the limited data that we have, because remember, we have not tested everybody. In South Korea, we know that the estimated mortality is about up to 4.3%, and most recently the data in China has shown up to 3%. What is really interesting is that the rates of influenza have been relatively low this year because of the physical distancing measures that are in place. We know a little bit more about risk factors. We know that age is a risk factor, and different studies have found different age categories to be at risk, but the older you are, the more risk, the greater the risk. So over 60 is considered one of the risk factors, although some data will say 65 or 70. We know a little bit more about comorbidities. What other kinds of conditions do you have that might put you at risk? Diabetes is one of the highest risk factors. Then you have heart disease, hypertension, for example, or high blood pressure, lung disease, people with emphysema or COPD, and possibly even obesity. What you can see that rheumatic diseases and other diseases in which patients are immunosuppressed really don't make the list of the top 4 to 5 risk factors. So that's somewhat reassuring. Now, nasal pharyngeal swabs for testing, we know a little bit more about that. No test, as you know, is 100%. And up to 30% of people with the infection could test negative. So if symptoms are compatible, it is important to retest if needed. The other thing is recovery. When do you recover from this infection? The recommendation is that you are recovered when you become asymptomatic. Other countries and other jurisdictions may be using swabs that are testing you, and if 2 negative swabs 24 hours apart are found, then you are recovered. But most of the public health agencies are really telling you to self-isolate if you become infected, and once you're asymptomatic, you are recovered.
So Dr. Lowe, we've all changed so much about our daily lives, how we see friends, how we do our regular routines. What new information do we have about how the transmission of the virus happens and any prevention?
Thank you, Sean. This is certainly something that everybody is very worried about, particularly with how contagious and how quickly this is spreading. So there's certainly some new information. However, it doesn't change anything, as Dr. Ahluwalia has mentioned, that we should and need to maintain the distancing. So that continues to be a very important factor. But what we have learned that is quite new is that transmission can occur actually 1 to 3 days before the symptoms appear. So it was previously noted that it was at the time of onset of symptoms that people were the most contagious, but now data is coming out, and through different case surveillance and monitoring, they've actually got a few clusters that were determined in Singapore to demonstrate that it's a high possibility that the transmission was occurring even before people were symptomatic. And some of the surveillance that they were doing included some video recordings to see where people were and how they may have gotten it. And there is suggestion that even people who have gone to the same church and maybe sat in the same seat somehow also transferred that on, because they've got a case where a person with the COVID positive test was then, or sorry, the person who sat in the same seat afterwards who was negative to begin with, then developed the virus. So it's quite interesting how this can relatively quickly pass, but something that we know so far is that the virus does enter the body through the eyes, nose, or mouth. So the best information we know at this point. So it continues to be very important to wash your hands and avoid touching your eyes, nose, or mouth until after you wash your hands. The infection is generally transferred or transmitted through respiratory droplets. Right now, other bodily excretions aren't associated with that transmission or it being contagious. And that's actually very important because it also means that not so much in Canada, but third world countries, that the water supply is not a problem. And certainly in developed countries like Canada, our purification processes and the filtration that goes on is sufficient to clear the virus. So our public water systems are certainly safe and is not a reason or a cause of spread. So there's been a lot of questions about, well, how is it actually passed on and how are we even still getting transmissions if we haven't been close to each other? And there is social distancing and distancing going on. There was a recent study, so again, this is brand new information that's just come out in the last few weeks, and that is some testing, and this is very important to recognize that this is in a lab. This is not occurring measured live or realistically. We do have to recognize that this is looking at it in a lab environment where there is an artificial way to test an aerosol. So these are mechanical ways of bursting the virus within an aerosol and then doing measurements. But what the labs have found is that it can live in aerosols for up to 3 hours. The virus can actually remain viable on plastic surfaces for up to 3 days, or at 3 days it was still measurable. And on stainless steel, after 2 days, you could still detect the virus. Now, no virus was detectable 4 hours after being on a copper surface, and no virus was detectable 24 hours on cardboard. Now, this has implications. This doesn't confirm for sure that this is how it's transmitted, but it's certainly plausible that an inanimate object might be the source of the transmission of this virus. So it does mean that you do have to wash your hands if you've touched a surface that could potentially be contaminated. And so this is why we're always talking about disinfecting doorknobs, washing your hands and other surfaces to make sure they're clean. And the virus can live there, and if you're going to touch your eyes, nose, or mouth, that there is a risk of then transmitting it. So taking precautions is definitely prudent, and we do have to be really on top of not touching our face, which is very difficult. It's something that we naturally just do, and we have to make all efforts to prevent it. So keeping our distance, so 6 feet, making sure you wash your hands, and remember to use soap and water. So soap, warm water, helps to break down the viral membranes and the viral structures so that it can destroy the virus. The physical act of washing the hand also gets rid of it too. So washing your hands for 20 seconds is particularly useful and important. Greeting people now, it's become very acceptable to be at a distance, to wave, to bow, to gesture. So we do have to recognize that this is how it's going to be as we move forward, and certainly until we can control this virus. When soap and water is not available, then certainly considering using a hand sanitizer, a disinfectant wipe, that is useful and would help to remove and destroy the virus. Using the alcohol hand sanitizers, ensure that it does contain an alcohol that is higher than 60%. So 60% and higher is what the WHO is recommending. And then also for masks, it is important to actually use masks, and that is also something that's new. So when should I wear a mask, if you're wondering, and what type? Well, there's now a few categories, and part of this is being rolled out because there is concern about the shortage and the availability of the N95 masks. So the big X that you see on the slide is not that they're not to be used. That is, it shouldn't be used or purchased by the average person, because that would be not an appropriate use given that we have a shortage, and we're really reserving it for healthcare providers who are in high-risk situations, who are dealing with patients who may be infected, and these masks are very important that they're available for our healthcare workers. So the CDC is recommending now that wearing a mask or a cloth face covering in public is something that's recommended. Now, it may not prevent you or protect you from getting the virus for sure. So we don't have any tests. It's unlikely that a cloth mask can help protect you from getting it. However, it can prevent you from spreading it if you unknowingly have the infection or have COVID. And as we saw in the previous slide, that it is passable or can be contagious even when that person is asymptomatic or is not exhibiting any signs or symptoms at all. So routine use of hand washing, using cloth masks when you can particularly might run into a situation where you're not staying away or keeping that distance apart is certainly going to be very important. Now, there are also surgical masks, and there are a few grades of them. If they are certified masks, they're color-coded. Yellow masks are essentially the lower level or level 1 of protection. As we move into the blue masks that are used in health and medical settings, they are a level 2 or 3, which better filtration and better protection. So those are reserved for caregivers working with people who may be infected or those that are high risk. So use of cloth masks, there are lots of postings out there on the internet where you can find good quality recipe, I guess, and some plans on how to put these together. And you can certainly make your own. And I know there's lots of people that are making them and donating them that are out there as well.
So Dr. Lowe, the Arthritis Society, we've received a number of questions about medical care. So what would you recommend for people with arthritis right now if they need medical care during this pandemic?
Well, I know with people who are very concerned about going into a healthcare setting, that they're a little bit afraid and apprehensive to enter into a waiting room and emergency rooms in hospitals. It might be why our hospitals are so empty. But I think it's very important to recognize that if you do have a condition, a situation where it does require medical care, don't delay. Don't avoid calling 911. The hospitals do have well-equipped health facilities, and it is important that you do get seen. So if you need to go to hospital, you do it. If you need to go to the emergency, you call 911 and you do get help. Do notify any healthcare providers or anyone treating you if you have any flu-like symptoms, because that allows them to protect themselves and take any precautions if they need to. It's important also, if you're going in for a medical appointment, to check ahead. So this is going to be different from what it was like before. There might be new procedures in place for that office on getting there. Certainly be on time, because scheduling is now particularly important, because we really don't want people in waiting rooms gathering. So they might ask you to wait in your car. They might have a way to call you and tell you to come in when they're ready and the last patient has left the office and that kind of thing. So do look into that and figure out exactly where you're going, whether it's a lab, whether it's a medical facility, you're going in for an infusion. Do check ahead, call in and see what the best way to approach that facility is. Realize that there's also a number of now virtual care available. There are physicians who are doing online visits. There are pharmacists who are doing education remotely via telephone and video conference. So do look into it and take advantage of that if that's available. It prevents an unnecessary trip if this is something that can be taken care of remotely. If there are unnecessary in-person visits, try to avoid those. If you're not sure whether it's necessary or unnecessary, certainly give a call to that healthcare professional and ask them what do they think and explain your situation. Remember that medication delivery is available for most pharmacies and usually without an additional cost to you. If you've got concerns about your infusion, discuss that with your specialist to see if there can be some changes, and we'll go into a bit more detail on that later on. There's also been a lot of questions out there about whether patients should be getting vaccines right now. There's concern with respect to this pandemic going on and whether is this the best time to receive a vaccine. And I would recommend that if you needed the vaccine, this COVID-19 pandemic shouldn't stop you. And if anything, this might be a time to make sure that you're well covered. And that's because that whether you're getting another infection, which a vaccine can prevent, you don't want to be infected now and then have COVID be around, or the reverse. You wouldn't want to be infected and then get a secondary infection from something that we could have vaccinated against. If you have symptoms of infection, certainly delay a vaccine. There is certainly no reason that you would take on the risk of getting a vaccine if you already have a current active infection. But you know, COVID-19 and what we're seeing right now in our current environment, there's really shouldn't impact the timing of it. Unless you have specific recommendations to isolate or you've been exposed, then it might increase the risk and you want to delay it. But having the protection of the various vaccines is generally going to be better and much better benefit than the potential risks or side effects associated with it. I know everyone is asking about, so when's a SARS-CoV-2, which is a COVID-19 vaccine, when might that be available? There is a lot of development going on, lots of research going on right now. Unfortunately, it does take time to develop and investigate and do research on a vaccine. It's certainly many months away, and if not, it's likely going to be over a year, in my opinion, before something can be released with respect to a vaccine. There's other considerations as well. Lots of folks are wondering whether the risk is worth it to go into an infusion center. And this is certainly the best discussion had with your doctor. Some people, it's possible to switch to an injectable version that you can do at home. So there are some medications that are the same medication available in a subcutaneous injectable pen that you can do yourself at home or have someone help you with, as opposed to going into an infusion center. There are also potentially some infusions that the delay might be possible. But again, this is on a case-by-case basis. I'm not recommending that you can delay or stretch out your infusions, but it is a possibility. So these are certainly some considerations to think about. With respect to going to lab tests, there are going to be individual situations with that. Some people are a little bit more sensitive where you do need to go in for a lab test as recommended on a regular basis because it's very tight monitoring needed. Others who are relatively stable, the risk of stretching it out may not be a bad thing given our current pandemic situation, distancing, and certainly trying to stay at home and not go out if unnecessary. So this is something that you can consult with your doctor about. And again, if you're going into the lab, make sure you call ahead and see what their procedures are.
So, Dr. Ahluwalia, many of our viewers, and we've had many questions about people's medications. So, during this time, what is your recommendation around continuing, stopping, changing, etc.?
So those are really good questions, Sean. And I think some of our viewers have sent in several questions, which I would like to answer in this particular section. So the first question that has come to play is that, am I immunosuppressed due to my autoimmune arthritic disease, or is it due to my medications? So what's interesting is that it could be both. So digging back into some of the data that we have, this goes back many years actually. We've known about the fact that patients with rheumatoid arthritis and perhaps even other chronic rheumatic diseases are about at double the risk of infection of the general population. Now that doesn't specifically relate to COVID-19 because this data is from about 10 to 20 years ago. This may be in part due to the immune dysregulation that is caused by the disease, but it can also be in large part due to the use of immunosuppressive therapy. What are the most common types of infections people get? It's mostly respiratory infections. But the classic infections are bacterial infections. And rarely we might see something like an opportunistic infection, such as a fungal or a yeast or tuberculosis. So the single most important thing to note here is, as Alan has said, you should keep your vaccinations up to date so that you reduce your risk. And the best time to do that is really when you are healthy. So the next question is am I at increased risk for COVID-19 due to my autoimmune condition or my immunosuppression? I did present this slide at the last webinar about a month ago, and I don't think much has changed around that yet, but I just want to refresh your memory around that. The morbidity or the damage that, or the inflammation that is occurring is actually not specifically due to the virus. It's actually your immune system that is activated, causing inflammation in reaction to the virus. So really, you know, as a result of having the virus, it's your immune system that is causing some of the complications. Now, could you have an increased risk of secondary bacterial infections? That's a possibility. If you get COVID-19, could you get another infection on top of that? We've seen that with other viral infections in the past. So that is something that could occur in people who are immunosuppressed, and that's why we have to be careful. Now, on the other hand, it's very interesting. It almost seems counterintuitive, as one of my patients said when I explained this. Could your immunosuppressive medications protect you? Well, this immune activation that is occurring, causing inflammation, is actually something called the cytokine storm. In other words, the inflammatory cells will release these small molecules called interleukin-6, sometimes interleukin-1, and they could be key players in terms of causing this immune activation and inflammation. So if your immune system is suppressed due to medications, it's possible that you can't mount that immune activation, and therefore you might be protected. We're not really sure, but that's the theory. And the other interesting thing is that some immunosuppressive therapies against interleukin-6, such as tocilizumab or saralimumab, also JAK inhibitors or interleukin-1 inhibitors such as Kineret, are currently being evaluated in treating some of the serious viral complications. And that is something that Alan will be discussing later. So what should I do about my immunosuppressive therapy? Last month, this is the advice I gave you because we didn't have much information. But the good thing is that we have more information now. The American College of Rheumatology COVID-19 Clinical Guidance Task Force actually got together very quickly. These task forces usually work over months to years to create guidelines, but they did that in the last few weeks. So this was published on April 16th. It's in draft form. I can share that with you today. And 8 rheumatologists as well as 4 infectious disease specialists got together. Based on the knowledge thus far and information presented to them, they were able to come up with some consensus, something that they all agreed on, guidelines for patients with autoimmune arthritic conditions who are taking certain medications. So if you start at the top and we have no exposure or infection, you're feeling perfectly healthy, you're doing great, you're staying at home, you have stable disease, then you would continue with the medications that you are currently on, whether they be anti-inflammatories, disease-modifying agents such as methotrexate or hydroxychloroquine, JAK inhibitors, certain biologics, you may be taking TNF inhibitors or prednisone. You would continue that. If your disease is active and you are healthy, then it's important to consult your doctor through the various methods that are available, and whether that be virtual or telephone visits, it's very important to contact your doctor. You may need an escalation in therapy, and that is fine to do right now. So let's go to the second option or possibility. That is if you are asymptomatic, so you don't have any symptoms, but you may have been exposed to contact who tests positive, or somebody whose test is pending. That actually, all of these situations have happened in my office this week, and we had to certainly give advice. This is the advice that I am giving currently. So if you have stable, or even if you have active disease, and this will have to be determined by your physician in terms of what the disease state is. If you are on anti-inflammatory medications or disease-modifying agents or steroids, currently the guideline is to continue as prescribed and consult with your doctor. If you're on interleukin-6 inhibitors, remember these medications are being studied as to whether they may be helpful in terms of improving the complications of COVID-19. So those can also be continued in certain circumstances in consultation with your doctor. And finally, JAK inhibitors or other types of biologics, TNF inhibitors, perhaps even other modes of action, should be stopped temporarily. Now, this should be done in consultation with your doctor, so certainly contact your doctor, and it should be stopped until the contact test is negative. So in that situation, basically you're not exposed, or you have no symptoms for the next 14 days. The third situation situation that comes about is if you have a presumed or confirmed infection. In that situation, again, it's important to let your doctor know, and I had that similar situation happen to a patient in my office this week. Anti-inflammatory medications are recommended to be started unless your COVID-19 symptoms worsen dramatically. Then they will likely be stopped. Hydroxychloroquine and Plaquenil at this point in time, I know there is new information that has just been published in the last couple of days, and Alan's going to talk about that a little bit more, but hydroxychloroquine and Plaquenil, it is recommended that you continue those and seek your doctor consultation. Same with interleukin-6 inhibitors. Steroids are not to be stopped abruptly if you are taking them, because this can cause a withdrawal reaction. So it's important to consult your doctor because possibly your dose could be lowered. Other disease-modifying agents, JAK inhibitors, and biologics, it is recommended that you stop those and seek your doctor consultation. So if you've had the infection and you are now recovered, when can you restart your immunosuppressive therapy? Again, doctor knows your situation the best and your condition the best. But in general, we recommend starting the medication once you have either had 2 negative COVID-19 swabs or you are symptom-free for about 48 to 72 hours. This could be 10 to 14 days after symptom onset, or it could be a little bit longer. So when you are well, then you should restart your medication, because the important thing is that optimal control of your disease will keep you healthy during this pandemic, and the risk of flare of disease if you do not restart your medication is very high. So it's important that you restart your medications as prescribed and let your doctor know that you are better. What about frontline workers? What do they do to stay safe? And especially those who are potentially vulnerable or living with people who are at higher risk. Alan has very appropriately told you to wash your hands frequently, don't touch your face, use masks appropriately, and avoid touching the outside of the mask. Actually, it should say outside of the mask. If possible, avoid working in confined spaces. Keep your distance from others after your shifts. Remove your clothes upon entering the home. Some people even put them in a certain area at the front door. Remove and leave footwear at the entry. Wash your hands, shower and wash your hair, and put on a fresh set of clothes, and then you can greet your household members. What about frontline workers with autoimmune conditions? Well, there's no clear national or global guidelines, but these are some of the things that you could consider. First of all, is your autoimmune disease controlled? What immunosuppressants are you on? Are you taking anti-inflammatories only? In that case, the risk is low. Can you work from home? Is it possible to do telehealth, or is it possible to do virtual care in the profession that you are? Do you have adequate personal protective equipment for your job, or could you be placed in a non-COVID-19 environment? Speak to your HR department to see what can be done for you, and also speak to your doctor if you have further concerns. And finally, as part of some of the questions that have been asked, are children and pregnant women more vulnerable? Those are good questions. What's very interesting about children, they appear to have fewer symptoms and less frequent need for hospitalization or even put on a ventilator. They seem to be tolerating this well. And it's interesting because children sometimes are asymptomatic reservoirs of disease. Children generally get 2 to 3 viral infections during the school year. And so they are perpetually bombarded with these viral particles, and perhaps they have a little bit of immunity. We don't know. But children with rheumatic disease on immunosuppressive therapy don't seem to be at any higher risk. What about pregnant women? Well, in 118 pregnant women with COVID-19 who were studied in Wuhan, China, there was no increased risk of severe disease. Remember, they don't have those risk factors. Young women in childbearing age tend to have less risk of severe disease, and there's no clear transmission of the virus to the babies or the breast milk.
So there's been a lot of conflicting information in the news about different medications that are currently being used to treat COVID-19 in the media. Dr. Lowe, could you give us a sense of what arthritis-related medications are currently being used and how people living with arthritis in Canada can be assured that they will continue to have access to these drugs?
Okay. Thanks, Sean. I'll start off with, are there any treatments for COVID-19? Of course, everybody's asking that. And the short answer is no, nothing has been proven. And there are certainly lots of studies going on. I'll go through maybe some of the drugs that you might have heard about, but certainly there's nothing out there that's going to prevent complications, prevent the disease. And many of these drugs, unfortunately, that are being used right now and tested that people are hearing about are in limited supply because they are produced only for, of course, a normal population where there is a certain level of the conditions that are being treated and not expecting it to have that supply diverted to treat COVID-19 patients. So the clinical trials that are going on, they are separate sources of drugs. So you don't need to be concerned that when there's a proper clinical trial going on, it's just when people are using it off-label and taking from the supply that's there. And that's where it becomes a bit of an issue and a concern. So there are no known therapies. There certainly are some, I guess, practitioners that might speculate and treat without data. Now, unfortunately, that can lead to a lot of confusion and inconsistencies because COVID-19 can resolve on its own. There are certainly many people who have recovered and have either no symptoms or very mild symptoms. If randomly speaking, somebody tried a therapy, they might think and suggest that the therapy had worked to prevent it, but in reality, it would have had the same outcome either way. So there is indiscriminate use out there. However, the WHO has created a form so that if someone is using it that way, that it does get captured and this information does get, I guess, compiled in such a way that we can start getting some consistency. So there is the World Health Organization recommendations out there. In general, there are no therapies that are recommended to be used. There are a number of drugs that are out there that are certainly being considered for clinical trials and are pointed out that that's where it's at. So here's a big list of drugs. I'm going to start off with, I guess, what's been talked about a lot, because you've certainly heard it in the media. And I know that President Trump had brought it out saying that this was going to be a game changer. I think that's actually the words that he used. But unfortunately, as recent as a couple of days ago, there have been some publications and data, new data that's been made available that have actually shown, and this is a case report, or sorry, this is a chart report, meaning that it's not compared with a placebo control. It is looking backwards as an observational study. And those people that were taking hydroxychloroquine with or without the azithromycin, which is an antibiotic, actually had a higher mortality rate. So it just goes to show you that we do need these tests and you can't just take it. Now, proper controlled clinical trials are still going on with chloroquine, hydroxychloroquine with and without azithromycin, and that's still being looked at. Other drugs that you might have heard of are tocilizumab, it's like Temra or sarilumab, Kevzara. It's also entering studies. And this relates back to what Dr. Ahluwalia was talking about, and that is reducing that cytokine storm. So these immune modulating drugs are really showing up and getting attention because they are affecting the immune system. And COVID-19 is also affecting the immune system in a bad way, causing this big storm, which gets it to attack your own body, causing problems. There are antiviral treatments that are going on, and there are some antivirals where it's actually been associated with increased harm, and those clinical trials have dropped off. So we're with vibravirin and interferon, those trials are actually now stopping and becoming fewer just because there was harm associated when we started to do some proper trials with it. With respect to corticosteroids, you should continue to use it as prescribed. This is not something that you should abruptly stop. This has to be tapered. And the fact that we're in a pandemic, the fact that whether you have an infection or not, the corticosteroid continues and might be tapered. And if you are having an infection, it's something that you do have to contact your doctor and speak to them about because your individual case might be different. The use of antibiotics is also not affected by COVID-19. We continue to use antibiotics the way we use them. Through social media and things like that, there have been rumors raised, and this is a myth, that ibuprofen can cause faster spread or worsening symptoms of COVID-19. That's not been proven, and there is not any strong association that is even suggesting that. So at this point in time, you would continue using ibuprofen if that's what you're stabilized on. If you're starting something new, let's say to treat a fever or to something new to treat pain, it's reasonable to start with acetaminophen. And this certainly works to treat pain. It certainly helps to reduce fever. And in some cases, from a stomach or a GI point of view, it can be safer than using ibuprofen. So where possible, certainly you can consider using that acetaminophen. Because of the comorbidities of heart disease and hypertension, the ACE inhibitors, as well as these angiotensin receptor blockers, or ARBs, have been implicated as potentially beneficial or even sometimes harmful, depending on how you look at it. Right now, the information is telling us that if you're using these medications, you should continue it. There's not any benefit to stop it, whether you are infected or not infected. So again, COVID-19 has no bearing on the use of these drugs. So you continue to use them as you have. Be careful with a lot of the scams and different kinds of information that are going on out there about supplements. So supplements are certainly a problem, and they may have claims that they will improve your immune system and those kinds of things, but none of it's been proven. There's no supplement or natural product that's going to help control or combat or prevent COVID-19. What will help it is the distancing, the maintaining of good health. So keep your body strong and healthy by having a balanced nutritional intake, balanced exercise and diet, and that's what's most important. When we're talking about the immune system, it was mentioned that, you know, when your immune system is weaker, you're susceptible to all infections, and COVID-19 is no different. This is not something that's special or different. It's another virus, another infection. So with a weakened immune system or on an immunomodulatory drug, you're at increased risk of any respiratory infection. No need to be in more fear of COVID-19 than others. So there's been some questions about medical cannabis. And just wanted to be clear with that, there is no benefit with taking medical cannabis either with respect to COVID-19. I know jokingly saying that, you know, they have said that cannabis is good for everything. Well, not necessarily so. There are some people who are taking it appropriately that's supported by clinical trials for treating pain, but now is not the time to start medical cannabis if you don't have a medical professional following you. And this is something that should be done at any time, that someone should help you and follow you and describe to you how to start and initiate medical cannabis. So at this time, no benefit with using it to treat or deal with COVID-19. Inhaled cannabis is always not recommended. There are certainly higher risks associated with impacting the airways and the lung. And I guess with the pandemic going on, this is certainly not the way to administer cannabis if you can avoid it. So there's lots of concerns about supplies out there with some of these drugs being used not for the normal use and purposes. So this is why you're seeing in some cases that pharmacies are limiting supply. And that's because of some of the drug is being diverted or used differently. We're also having some delays or anticipating possible delays of shipping and supply. So as a result, to ensure that everybody can have an adequate amount rather than a few people having large supplies that sit at home in their shelves, we're reducing it so that we will have fewer people run out of the medication. So as a result, you'll see that some pharmacies are reducing you to a 30-day supply that is being recommended by Health Canada. And drug trials use a separate supply of drug for its use. So this is not something that you need to be concerned about, that we aren't going to be running into any problems of drug supply. So we're keeping on top of it, and we have assurances. In fact, the minister has cleared some movement of drug supply coming in from China, so that it is been cleared. There was a holdup actually of 5 million tablets, but now it's been confirmed. Minister Eng and Dr. Tam have confirmed that we will be getting it. So we're in good shape.
So thank you very much, Dr. Lowe, for giving us that overview. Access to medications is one of the Arthritis Society's key advocacy priorities because it's important that patients maintain that access. So we would just like to take the chance right now to get a little bit of feedback from the viewers with the following question, if we could. Have you or anyone you know had trouble accessing arthritis medications over the last month? Okay. So thank you all very much for giving us that interest. We know that this is a hard time for people being at home, and the Arthritis Society has a number of tools and resources on our website to make it through this challenging time. Make the most of your time at home, stay active, eat healthy, take your medications as directed. And we also have a Flourish e-newsletter that can really help you utilize the resources that are offered here. So stay informed, but don't let the information in the media overwhelm you. Make sure that you're getting your information from reputable websites, and there's some of them here for all of you. So with that, I think we've been able to cover a lot of ground over the last little while with the prepared slides, but we're going to take some questions that have come in and not been addressed explicitly. So first, maybe I'll ask Dr. Lowe, in particular with hydroxychloroquine, is it safe to increase the time between my medication doses at this time?
So with regards to trying to extend out your medications, I'm not sure what the reason behind that would be. Some might be trying to preserve their supply. And again, there's no need for that. You should be able to get it from your pharmacy. And if not, there's going to be a pharmacy that will deliver it to you that does have stock. So at this point in time, we're not running out. So there shouldn't be any reason to stretch it out. If there's a particular reason, side effect, or you think you're on the wrong dose, that's something to talk with your doctor about to see if you need to spread out your dose of hydroxychloroquine. And with respect to having COVID-19, it would be something that you'd continue, regardless of the studies that are coming out now that you might be hearing based on that observational study that it might be harmful. This is harmful to people who are just starting taking it. These aren't people who have been taking it for a long term and have suddenly then developed the infection. So if you're going to be stretching it out, do consult with your doctor to see if that's the appropriate thing. But there's not a recommendation to just stretch it out. In fact, there's some drugs that are potentially harmful if you do. And so some of our patients, they are on a drug called denosumab or Prolia that's given every 6 months. Some people have wanted to stretch that out. And there's actually specific data to say that there's an increased risk of fractures even as soon as 2 and 3 months afterwards. So it's not always a good idea just to make your own decision to stretch things out. It really depends on your situation and which drug it is.
Thank you for that. So Dr. Ahluwalia, you covered a lot of detail about what drugs people are currently on, and we've had some questions about, is this a good time to start a new drug for my rheumatic condition, or should I hold off?
So I think it's really important to understand that active rheumatic disease is not a good thing. Control of your disease is the best way that you can stay healthy and avoid some of the risks in terms of this virus and perhaps even other infections. Because active disease actually puts you at higher risk of getting infections. In addition, if you don't treat the disease, there could be damage down the road that that is going to make you not well and not be able to function properly and do all the things you want to do in your life. So I think it's important that if you do have active inflammatory disease that requires treatment now, that you are safe to go on to that treatment, assuming that you are otherwise healthy.
Okay. So we've had some future-looking questions around a potential vaccine, and in particular, when a vaccine is available, we know that there are some challenges with people with rheumatic disease and live vaccines. So the question is, will people with rheumatoid arthritis be able to take the vaccine when it is available? So maybe Dr. Lowe, you could help us with that.
Sure, let me start off with that one. And of course, right now, it's way too early to know what kind of vaccine we're going to get. So let's do a little bit of extrapolation. The flu vaccine is a virus, and it's an attenuated vaccine. And this one is safe for those that are immunocompromised, whether it's through an inflammatory disease that's a rheumatic disease, like arthritis, or you're on a biologic, so that it is safe to take together at your biologic. There's some timing intervals that we want to optimize so that we're not taking it just too close to the biologic. And there are some interactions that we're worried about. For instance, methotrexate, we do have some data. We know that it blunts the response from a flu vaccine. So we have some information there, and it takes time to gather that. So at this point, when we don't even have the vaccine, it'd be too presumptuous to try to make guesses at what it's going to be like. But we do have history with flu vaccine, and we know that that is safe for our rheumatic patients now. And so I think that it's going to be likely the same. So it will be some time before we get that vaccine and no more.
Okay. Dr. Ahluwalia, we've had a few questions about osteoarthritis. Could you give us a sense of, well, the question is, am I more at risk for catching the virus if I have osteoarthritis, or of having a more threatening case of COVID-19?
So I think your risk with respect to having osteoarthritis, which tends to be a degenerative joint disease and not so much an autoimmune disease. So I don't think your risk is any greater than in the general population, but that does not mean that you should not use all the precautions that are recommended for the general population, as we have mentioned earlier in our presentation. So keep safe and stay at home, and that way you'll stay healthy.
Okay, Dr. Lowe, someone has asked, I've read some data that suggests that some people who are on immunosuppressants might actually have a degree of protection from the cytokine storm related to the coronavirus. Do the drugs that people are on offer some kind of protection that we know of?
So right now, of course, as I mentioned, those studies are going on. And there are a couple of drugs that are IL-6 receptor blockers that appear to be potentials. And right now, these are too early, I think, in investigations to say for sure. But what it does suggest is that you shouldn't stop it. So that we know. And we are worried about immunomodulating drugs at sometimes when you get an infection. Should you be stopping it? Should you be continuing? It's always a individual situation, so it's best to talk with your doctor about your circumstances. But in general, there is indication that IL-6 type drugs are ones that could be protective, in fact. With the other ones, we don't know. We don't have the data. And we also know that some have been harmful in certain cases, like the interferons. So it's not exactly clear, and more study needs to be going on. And those trials are ongoing. So we hope to have those information very soon.
Okay, Dr. Ahluwalia, can someone be reinfected with the virus? And do we have any sense of when there might be antibody tests that are available?
That's a really good question about a reinfection. When you get an infectious disease, you do create an immune response and an antibody production that protects you. So for example, if you have, we know from the varicella virus or shingles, herpes zoster, another name for it, that if you do get the infection, then it is, actually that's really a reactivation of your own chickenpox virus, but if it reactivates, you have antibodies for a year. So in this particular circumstance, it's not clear how long you have antibodies for. Do you have it for 3 months? Do you have it for 6 months? Do you have it for a year? Do you have it for life? We're not really sure at this point in time. And the question can be answered if you have recurrent symptoms and you are re-swabbed and you are found to be positive again. So some of these types of studies are being done in China, where they are routinely re-swabbing patients to see how they are doing. And we may have some information in the future.
Okay. We've had a few comments about recent outbreaks in food packaging plants. So Dr. Lowe, do we need to worry about the packaging on food, and for what period of time, if so?
So I think certainly to be safe, and because we do have laboratory data suggesting virus can live on surfaces, you should wipe down the packaging of your groceries. So soap and water as you wipe down and clean the packaging. With respect to the food, there has been no reported transmission by food at this point in time. I don't want to be proven wrong later, but right now there's been a lot of food that certainly has been passed, and there's a lot of detection that's going on to try and ascertain whether that's going to be an issue or not. Maybe I'll take an even further extrapolation and say that, and this has just come up too, is that I think there have been 2 cats tested COVID positive in New York. And one of those cats is living in a household where there's no one with COVID. and a cat that was with a human owner that had the COVID virus. So it appears that these cats can have it, but haven't been shown to be a vector. It's the first time that cats have been tested positive, yet there is no link to any transmission from cats to humans. One thing we should be cautious of is you probably shouldn't be kissing your cat, just in case, because they are going outside. You don't know what they're getting into, and they could be touching surfaces that are contaminated with virus. We just want to be careful and prudent at this point in time. So I'm not going to suggest that we need to go crazy and be wiping down and you know, cleaning food and this kind of thing. But certainly heat destroys a virus, so make sure your food is well cooked. If you have any concerns, reheat the food. And not only does it get rid of bacteria and things that we're afraid of with regular, but it should also destroy any coronavirus that might be something that you're concerned about too. So I would suggest wiping down with soap and water, just packaging, and wash your hands before you then consume the food.
Okay. And my last question maybe for Dr. Ahluwalia, we're starting to hear people talk about when cities, when provinces start to open up. Are there any particular precautions that people living with arthritis need to consider as they're starting to enter grocery stores and things like that in a different way?
Yeah, so our public health agencies are keeping abreast of all this information. And when indeed will be the right moment is still unknown at this point in time. So when they feel that this is something that is possible in terms of people getting out, socializing, getting together in groups, when that's going to happen and how that's going to happen, I think is going to be determined by the public health agency with the most up-to-date information that they will have. So stay tuned, and I'm sure you will be informed in many different ways, as you have so far, as to when that'll be happening, and we're all looking forward to that.
So thank you, Dr. Ahluwalia and Dr. Lowe, for providing this really important information today to help Canadians living with arthritis help manage through these challenging times. If you did not hear your question asked, please visit the Arthritis Society's COVID-19 webpage at arthritis.ca/COVID-19, and we will work to put as much additional information up on that page as possible in the days to come. The video and presentation slides will be emailed to all registered participants this weekend, and the recording of this webinar will also be available on arthritis.ca/COVID-19. Please share it with anyone you think who might find it helpful. We'd like to take just a few moments to get your feedback on today's presentation. So those of you on a laptop or desktop, you'll see 2 more poll questions come up on your screen with yes and no answers. So please do click on the responses that reflect your thoughts. Did you find the information in today's webinar helpful to you? And would you like us to host another COVID-19 focused webinar in the coming weeks? We will be sending an evaluation form when we send out the video. So if you're unable to access the poll questions, you will certainly have the opportunity to offer feedback at that time. Initiatives such as this come at a significant cost for the Arthritis Society, and we are very grateful to Amgen, the Calgary Foundation, and the Province of British Columbia for their financial support of this event. We would welcome your support to help us enable to continue our efforts, so if you have the capacity to do so, please visit arthritis.ca to consider making a donation. And please remember that there's excellent information available on our website at any time, tools, tips, learning modules, and a variety of content designed to assist you from the comfort of your home. Thank you again to Dr. Ahluwalia and Dr. Lowe, and to all of you for joining us today. COVID-19 is a rapidly changing situation, but what is not changing is our commitment to Canadians with arthritis. This concludes this special edition of Arthritis Talks, your questions, our answers about COVID-19 and arthritis. On behalf of the Arthritis Society, thank you very much for joining us today, and please do stay well.